So the patient we'll be working with today is a 25-year-old male. He was involved in a motor vehicle accident resulting in a TBI and right upper extremity amputation. So we're going to be practicing with him sit to stand today. He performed these fairly well. So we are just going to use a blocked practice, performing repetitions with him, which will increase the musculature in order to perform sit to stands and the quality of the sit to stands. So we are going to use part training in the beginning. It's going to transition into a whole training. So part training, we are going to do mini squats and then transitioning to whole training when you're going to be performing the full sit to stands. You're going to have the patient perform this in a quiet and closed environment in the beginning with the least amount of distractions. You're going to have verbal, simple commands for cueing and tactile cueing as well. And then again, we'll progress this when the patient is comfortable after so many sessions in performing this in an open environment. So the patient will do this in a busy clinic or out in the community. So the patient, during this, the therapist will be decreasing the cueing and the assistance given in order to challenge the patient's attention to task. Okay, so we're going to begin with a yoga mat. So we're going to utilize the yoga mat to perform these sit to stands. So with the yoga mat, we have it fully rolled up. So we're going to put this in a chair with armrests and a nice sturdy back. So with the yoga mat rolled up, it increases the height of the chair. So what we're going to do, just instruct the patient to perform a mini squat, down to the yoga mat and back up. Down and back up. We're going to have the patient do this 2 sets of 10, and then once when the patient is able to do that in a few sessions, progresses to 3 sets of 10. And the patient is going to be doing these sit to stand activities while they're coming to therapy. So they're coming to therapy about 3 times a week. So the next thing we're going to do to progress this, we're going to unroll the yoga mat. So it is not as high. So what the patient is going to do is, again, perform those mini squats, but they have to do a deeper squat now. You're going to go down and up, down and up. And again, since we increased the intensity of this with the lower height level, we are going to perform this 2 sets of 10. When the patient is ready, we're going to perform this 3 sets of 10. So again, the next thing, unravel the yoga mat all together. Have it at the bottom of the seat. And this is still just a little bit higher than the seat itself. So we're going to go down and then back up. And then down and then back up. And then same frequency and intensity for performing this sit to stands. And then we're going to place the yoga mat on the floor. This will decrease the friction the patient is standing on. So we can do this now whole training. We can do full sit to stands, so sitting and standing, sitting and standing. So you can have the patient at first push up off the chair as needed, but progress them to just going down and back. So now you can progress the patient to doing sit to stands, and then you can have them do some ankle sways. And then you can progress this to doing step strategy and hip strategy. Again, doing about 3 sets of 10. They'll be coming in 3 times a week. Again, doing this in a blocked practice. In the beginning, in an open or closed environment, progressing towards an open environment. The next exercise we're going to be working with this patient is balancing while standing. This person has impaired dynamic balancing, so we're going to do different activities to challenge their balancing through dynamic activities. So first off, we are going to be utilizing a blocked practice where you're continually doing the activity over and over again until the patient correctly and safely does this, and then you then progress to move on to the next activity. You are going to be utilizing a distributed practice where the practice time, doing the activity, and the rest breaks are about the same time. And then you are also going to be, this is going to be a whole part learning where all of these activities are going to be a dynamic balancing activity, but each activity, when we progress, it challenges that patient. So what we're going to do, utilizing the mascara bottle, we have our therapist, and the therapist is going to move the mascara bottle at different angles, different positions, and you're going to follow it with your head. And then we're going to progress and follow it with your arm. So the patient will follow it with their arm, and then we're going to do some imagery tests. So first off, we're going to be a narrow base of support, and then we're going to have the therapist move the mascara bottle in different positions. Okay, then you can progress to moving with your arm. Okay, and then the next task you can do is take vision out of the exercise, have the patient close their eyes, still standing in that narrow base of support, and you're going to have the patient imagine following that mascara bottle. So you can do this with head turns, you can also do this with arm motions. And then to progress this, once you think that the patient is safe enough to progress, you can change to tandem stance. Then you can change to a single leg stance, and then you can also, we are on flat surface right now, so you can do an air X when the patient is ready. You can then progress to a rocker board, and then have the patient do this for 2 sets of 10, or you can do this for so many seconds. So in the beginning you can say, we're going to do this 3 sets for 10 seconds. Once the patient is able to do that, progress to 5 times 10 seconds. And then after that progression, just progress as needed. So increase the seconds to see how long the patient can dynamically stand. And we're going to place it on the ground. So this has a little bit of height off the ground, and we're going to be using part training, transitioning to whole training for gait training. So the part training is we're going to be doing steps back and forth, like a step strategy, and then working towards whole training with doing the full ambulation. So the first activity we're going to be doing with the patient is just doing steps, so back and forth, back and forth. And this we can transition into full steps, back and forth. And then we can have the patient step all the way over and all the way back. So this we're going to be doing 3 sets of 10. So we're working in a blocked practice. 3 sets of 10, again, is part training, transitioning to the whole to ambulation. So the part practice, and then doing these with repetitions. And then we can have the shoes come apart, and then staggering them about certain widths apart. So we're going to start with them far apart, and we're going to be staggering back and forth. So weaving in and out. You're going to do this in a closed environment in the clinic first, and then you can progress this to more of an open environment in the clinic, walking through obstacles, and then progressing this again to a more challenging open environment in the community. Just for the beginning right now in the clinic, we can do repetitions, so we can do this for 5 laps, so going up and back is 1, so doing that 5 times. And then when you transition to more to community, you can do this in like a distributed practice with rest breaks. But you can do this with like for certain many minutes, like have the patient weave in and out of the community, while ambulating for like 5 minutes before they take a rest break. So progressing that, same closed environment in the clinic, moving towards an open environment in the clinic, and then to the community. But when the first one we were wide, shoes were staggered wide, now we can do them close together. So the patient has to have a sharper turn while doing this. So sharper turn while doing this. The next activity you can have is you can just have a obstacle in the middle of the walkway. So you're going to go up, you walk past it, you go up, walk past it, then you can transition to 2 obstacles. Walking, stepping over it, walking, stepping over it. Again, you can do this for 5 laps, so back and forth in the clinic, and then transitioning to out in the community. You can do this, again, you can do this for the laps or for so many minutes out in the community before a rest break. So for all of these activities, these are hardwood floors. You can transition them to ambulating on hardwood floors, then onto carpeted, and back to hardwood floors. And then when you're out in the community, you can have them progress to walking on the sidewalk, up and down curves for uneven terrains, then walking towards the grassy areas to challenge the patient. And then with each activity, when you're progressing them, you can decrease your verbal and cueing and assistance that you give to the patient in order to challenge their attention to task while doing these activities.